Honey.
Hi, my name's Marie. I'm your student physical therapist. How are you?
I'm doing good. How are you?
I'm good. So I'm going to ask you a few questions about your pain level and where you live, and then kind of what to expect when you go home, in addition to getting you up and walking. We should be working together for about 45 minutes.
Okay, sounds good.
Okay. Any questions before I start?
Not yet.
Okay. So can you go ahead and tell me your first and last name?
Christine Wade,
Good. And then when's your date of birth?
May 9th, 1950.
Okay, cool. I'm just going to check and confirm. Very nice. So can you tell me where you are right now?
Yeah, I'm at Emory Hospital.
Okay, and what brought you into the hospital?
I had to get my knee replaced.
Okay. Do you know why you had to get your knee replaced?
I've had arthritis for a long time.
Okay. Can you tell me what your current pain level is?
I'm like at a 7.
7. Have you had pain medication today?
Yeah.
Yeah. Okay. Are there any certain positions or anything that makes your pain more or less?
It feels better when it's a little bent.
When a little bent. Okay. But right now it's laying flat and it's all right?
Mm-hmm.
Okay. Cool. And then can you tell me what kind of place where that is? At a house or an apartment?
Yeah, I live in a house.
Okay. Do you live with anybody?
I live with my husband.
Okay, and then how often is he around? Does he work full time or?
Oh, he's around all the time. We're both retired.
Okay.
I mean, except when he goes to the golf course. You know, he just loves to golf.
Yes. So when you enter your house, do you have any steps to go inside?
I do. I have 4 steps to my
Okay. Once you're inside, is your bathroom on the same level as your bedroom?
Yes, it's a 1-story house.
So everything's pretty much accessible.
Mm-hmm.
Okay, great. And then you said you were both retired?
Yeah, we're both retired.
Okay, cool. So, in addition to being retired, what do you do for fun? Like, what does a normal day look like?
Oh man, like I said, I haven't got to do what I used to like to do, but I used to like to go walk in the mall, and I had a whole girls group that I would go walking in the mall with.
Mm-hmm.
I like to play bridge,
Okay.
and you know, I like to play with my grandbabies, so I
Okay.
like to keep them.
So you were pretty active before?
Mm-hmm.
Okay, cool. But you were able to walk on your own and everything before?
Yeah, no, I will not use a cane if I don't have to use one.
Okay, gotcha. So we're going to work together today and try and get you up and moving so you can kind of get back to that lifestyle. Sound good?
That sounds very good.
Okay.
Hi, Mrs. Wade. How are you today?
I'm good.
Good. I'm Alex, and I'm one of the SPTs, and I'm going to be taking your vitals before we get started on any more of your therapies. That sound okay?
Sounds good.
All right. I'm going to start by taking your blood pressure. Next, and then I'll stretch your arm. All right. What I'm going to have you do is going to have you bend your arm this way. I'm going to resist you. Okay? You can relax. Alright, do you know your blood pressure is normally?
It's usually in the 110s.
About 115/76. Nice and healthy. Right, and now I'm just going to take your pulse. I'll timer out here. Nice strong pulse. Alright, I'm just going to take one more measurement. Just relax and look away from me. Alright, so your pulse was 60 beats per minute, and then your respiratory rate was 18. Okay. Looks
Are those
good.
normal?
Oh yeah, those are normal. You're very healthy. Alright, so the last thing I want to do is just check the sensation in your legs and make sure that we're ready to go for walking today. Does that sound alright?
Sounds good.
Alright, great. Just going to roll this up if that's okay. Alright, I want you to close your eyes, and I want you to tell me where you feel me touching you.
And the inside of my legs?
Okay, does it feel about the same on both sides?
Yes. The outside?
Does it feel the same on both sides?
Yes. Top of my feet?
Does it feel about the same?
Yes. Inside of my foot?
What now?
Same.
Okay,
Outside of my foot?
okay. Now keep your eyes closed. I want you to tell me which direction I'm pulling your toe.
Towards my face.
Okay,
Out to the right. And down. Up towards my face. Out to the left. And down.
That feel about the same on both?
Mm-hmm.
All right, great. You put your socks back on. All right, everything looks good. I think you're good to go to continue with our therapy session today. So just hang tight and we'll be in to help you with bed mobility.
Sounds good.
Hey, Miss White.
Hi.
How are you?
Good.
Good. My name's Elliot.
I'll be your student PT for the day.
We're gonna check on some of the things, check on your strength, check on your flexibility to get you prepped to get walking again. How does that sound?
Oh, so good.
All right, fantastic. So first I'm gonna go ahead and check your incision point just to see how it's progressing. Do you have underwear on?
Yes.
Under your gown? Okay, fantastic. So I'm just gonna go ahead and take a look, see if there's some redness, swelling. Let me know if there's any pain.
Yeah,
I know it's still probably a little numb.
but
Okay.
nothing out of the ordinary.
Looks pretty good. No considerable heat, no considerable redness. It looks quite normal. Looks like it's starting to heal nicely. Okay, so I know that you reviewed some of the precautions prior to the surgery. Do you remember what those are?
Nope.
Nope. Okay, well, I'll refresh your memory. So with the knee replacement, the biggest thing is really you don't want to be planting your foot and rotating. So when you're making a turn, you want to make sure that you are going to be taking a bunch of little steps, at least for the first couple weeks to a couple months.
Okay, I remember that now.
Do your best to keep it into as much extension as you can. We really want to try and promote that range of motion, get you back to neutral. So as much as you can, try and make sure you're moving it as best you can given the pain levels, so within your tolerable pain levels. Okay, so what I'm going to do first, I'm going to check and see some of your range of motion of your upper body. Can I have you do your shoulders out like this? Excellent. Everything looks good on the upper body. Wanted to make sure that you can support yourself when you're trying to get up.
Oh, okay.
So that looks great.
I was wondering why you were doing
Sure.
the body.
Okay, now I'm going to go ahead and check some of your knee. Your lower extremity strength and range of motion. Can you go ahead and slide this heel up to your butt for me? Okay, any pain with that? No? Okay. Let's go flat. Can you lift your leg up off of the table? Okay, any pain with that?
No.
No? Okay, so I'm going to help you with this side because I know it might be a little stiff and a little weak from the surgery. So I'm going to have you slide that heel forward. Okay, a little bit tight there. All right, that's expected. And let's see you push down. Okay, now can you at all lift that leg up? Okay, I can see some activation there. That's good. Let me check your dorsiflexion, plantar flexion. Can you go ahead? Let's see you point your nose to your face. Okay, how about this one? Okay, that's expected. And let's see you point them towards me. Okay, any pain with those? No? Okay, fantastic. So what I'm going to have you do now is I'm going to check some of your strength behind you. So I want you to push your knee into my hand as hard as you can. Ready? Okay, nice. Good quads. I want you to pull this forward. Okay. And push against me. Okay. We'll do the same thing with this leg. All right, so I want you to push as hard as you can. Okay. Good. 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 Excellent. Okay. Check some strength here. What I want you to do is I want you to resist. I'm going to pull your ankle out. So I want you to resist that motion. All right?
Okay.
Ready? Good. I want you to kick your leg out. Okay. That looks good. Now what I want you to do is I want you to bridge. This is going to be the final test. Then we'll be all set to stand. Okay. So I'm going to bend this knee just slightly, as much as we can. Can you scoop this out a little bit? Okay. What I want you to do is I want you to try and pick your butt up off of the bed there. I'll hold your hip ankles. Ready? Nice work. All right. Any pain with that? Pain in that left knee? Okay. Well, you're certainly strong enough. We're going to get you standing in a couple minutes. So.
Good.
All right. Sounds good.
Hi, Miss White. I'm Rachel. I'm going to be one of your SPTs today.
Hi, Rachel.
So I understand that Elliot was in here and checked out all of your strength and range of motion, so you're good to go to sit up.
That's what he said, yeah.
Perfect. So if you have any intense pain while we're moving around, or you feel lightheaded or dizzy, just let me know. But yeah, we'll get you sitting up on the edge of the bed. I'm gonna put the knee immobilizer on, and then once you're sitting up, I'll put the gait belt on. We'll get you in the chair, and then I'll show you how to use the rolling walker.
Okay.
Do you have any questions for me before we start?
No, not yet.
Okay, if any pop up, let me know.
Okay.
So we'll get this on here first. Can you lift this up as much as you can, and I'll help you? Perfect. You can relax. Do you have underwear on today?
Yeah, I'm
Okay.
actually wearing shorts.
Okay, perfect. I'll go ahead and take this, put it out of the way. All right, and again, we want it to be snug but not too tight. How's that feel?
It feels good.
Perfect.
Yeah.
All right. So next, we're just gonna sit you up onto the edge of the bed. I'm gonna lower it just a little bit. So now I'm gonna have you sit up, and I want you to engage those abdominal muscles that Elliot was testing with you, and use your arms to push up.
Okay.
And if you get dizzy, just let me know, and we'll kind of take a break.
Okay.
All right. So sit up. Good. How's that feel?
It's good.
Any
Yeah.
dizziness?
I'm feeling okay.
Okay, good deal. So while you're sitting here, I'm gonna go ahead and put the gait belt on, and this will just help me grab onto you if you do happen to lose your balance or anything like that. And you don't have anything on your stomach that we need to worry about this being in the way of.
Man, between this gait belt and this gown, I sure do look fashionable.
You are styling.
Ugh.
And again, I want this to be snug but not uncomfortably tight. Is that okay?
Yep.
All right. All right, so next I'm gonna have you use those arm muscles, use your bottom muscles that we were working earlier, and help swing those legs toward me, okay?
Okay.
And I'll help with this leg.
Okay.
Good. Just pivot around. Perfect. And I'm gonna see if we can get this down to the ground. Excellent. How's that feel?
Good.
No dizziness?
No, I think I feel good.
Feel
Yeah.
good to sit up?
Yeah, this feels
Excellent.
nice.
All right. How's your pain?
It's not increasing. It's
Okay.
pretty much still at a 7.
About the same?
Yeah.
Okay, good. So I've got this walker already set to your height, and we'll double check it when we get you standing up. What I want you to do is, just like you are with your arms right now, push up from the bed and then grab onto the walker. I don't want you to pull it towards you because that's not safe.
Okay.
And since you're weight bearing as tolerated on this leg, put as much weight on it as is comfortable, but if it's too much, you can always kind of back off.
Okay.
So again, we want to engage those core muscles, engage your arms, and push up, and then you can grab on here. And I'm going to help you with the gait belt too. So on the count of 3, keep your hands on the bed to push off.
Oh, okay.
Perfect. So we'll kind of get some momentum going, and on the count of 3, stand up. 1, 2, 3. Perfect. Good. Dizziness?
Whew. I think I'm okay.
Okay.
Yeah.
Very good. So now to walk, and we're just gonna move to the chair for a minute. I want you to move the walker first, and then your left leg, and then your right. Good. And we want to take those little pivot motions like Elliot talked about. Good. Walker, left, right. Good. And turn toward me. Walker, left, right. And we want to back up until you feel that chair on the back of your legs. Feel it?
Yeah, I feel it
Okay.
now.
Now you can reach back for the armrests
Okay.
and slowly lower yourself down. Excellent. How's that feel?
Feels good.
Good. You did really well with the walker. You feel like walking a little bit further distance? Take a breather.
Catch my breath, but yeah, I'm
Okay.
ready to. I want to get better.
So we're going to do the same thing to get up again. Engage all those core muscles. Use your arms to push up off the chair, and then grab on here. Okay? And we can get that momentum going again. 1, 2, 3. Grab on here. Still feeling good?
Yeah.
Awesome. So
Yes.
remember, walker, left, right. Good. Walker, left, right.
There we go.
All right. So I'll get this out of your way. How you feel?
Feel good.
Yeah?
Yeah.
Awesome. So I know that you have some stairs in your home, so before your discharge, we'll make sure we get some more gait training, get some stair
Okay.
training so you can navigate those.
Okay.
Yeah, do you have any other questions for me?
No.
I'm Chelsea,
I'll be your student physical therapist.
and I'm just going to go over some of the things that other PTs have gone over with you and make sure you understand everything and teach you some exercises you can do while you're in the bed. But I don't think we've met. Who are you to Miss Waite?
I am her ball and chain.
Oh, wow. Nice to meet you.
Been in it for about 50 years.
Wow.
Don't give her such a hard time, honey.
We've heard a lot about you, so it's really nice to finally meet you.
I'm sure you have.
Yes. So I know some of the PTs have already gone over with you some of the precautions, but we really want to stress that, so I'm just going to go over them with you again. So really the big one when you have your knee replaced is when you are standing on your knee, you don't want to twist it. So I know you had some gait training with the walker, and so when you're turning a corner or have to turn it all, just take a lot of steps so you're not planting and twisting your knee. That's a big thing we want to avoid. And then eventually when you get discharged and are have more functioning, we don't want you to run at the beginning, and we don't want you to like bend and lift really heavy objects. That's
So you're gonna have to do all of that.
Yes, so you're gonna have to help lift things around the house. You're gonna have to maybe step it up.
You gotta carry my weight. Okay.
Yeah, carry your weight. So I'm gonna teach you some things you can do while you're in the bed, just to kind of get your leg back up to functioning, and just some things when we're not here that you can do to help you kind of progress yourself further. So one of the things you can do is we really don't want that knee in a flex position like this. We want to keep it extended, so it's really great. So I'm just gonna put this right here. It's really great to put like a rolled towel or a pillow under your knee, and I'm just gonna lift your leg up like that. Any pain?
A little bit.
Okay, now I know that's a little uncomfortable, but if you can tolerate it like that for just a little bit, or even decrease how high it is if that's too much, keeping your leg in an extended position while you're in the bed is really great for your knee.
And this will get me better faster.
It will get you better
I'm
faster.
gonna do it.
Yes. And another thing you can do is if you can press your ankle on like you're pressing a gas pedal like that down. Those are called ankle pumps, and those are really great to do. They help prevent blood clots in your leg, so it's great to just keep your leg moving. So yeah, just like that, that's great. Another thing you can do is we really want to work on your quads and glutes and get them strong. So what you can do is if you can just squeeze this muscle for me, great. And so it's just activated, and you just squeeze it, and it's just keeping that muscle activated. It's going to help you progress. And if you can squeeze your glutes together, great.
My honey got that booty.
Oh, honey! Not in front of the physical therapist, she's a doctor.
I know, but sheesh.
Well, hey, if you can be encouraging to her with these exercises, that would be great, because the more support she gets from you, the faster she's going to recover. And also, we'll be checking while you're in the hospital, but once you get home, just check that incision site every day. Make sure there's no swelling or drainage or redness, and make sure that if her calf ever gets really red and hot and painful, and it doesn't look like the other one, just let us know. So I think all of these things are really going to help you get back to your higher level of functioning. You'll be playing with your grandkids and walking through the mall as soon as you can.